Toronto's top doctor is renewing calls for paid sick days. She says that it has become increasingly clear during this health crisis that they are essential to protect workers, workplaces, and the broader community. But the number of low-wage workers with access to paid sick days is startlingly low, and they are a group largely considered essential. An urgent push to provide workers with better benefits. In a new Board of Health report, Toronto's medical officer of health calls on the Ford government to ensure all workers in Ontario have access to 10 paid sick days during the COVID-19 pandemic.
If the province is serious about doing everything, absolutely everything in their power to stop this second wave, sick leave is an essential component of that.
Essential to curb the spread of the virus in workplaces. 60% of the workplace outbreaks in Toronto have taken place in essential frontline environments, where the majority of employees are low-income workers.
The very workers who don't have sick leave are the ones continuing to work and continuing to get sick. We need to do something different here. Not just restrict movements, but provide enhanced supports to those who can't stay home. I mean, this isn't rocket science.
Only 42% of Canadians have access to paid sick leave, but that number drops to just 10% when it comes to low-wage workers. There's no federal legislation providing paid sick days for Canadian workers. The onus is on provinces. And in Ontario, the Ford government actually replaced 2 paid sick days with 3 unpaid sick days prior to the pandemic. During COVID, they extended the policy from 3 sick days to an unspecified number, but still unpaid. Toronto's mayor frustrated.
It is time for one of these two governments, and I've been in touch with them both about this, to step up. I'm almost to the hair lighting on fire time with this, where the fact there has been no response from anybody about this, when we know from our public health people and we know from the facts and figures, this is a real source of fear and concern.
The federal government did introduce the Canada Recovery Sickness Benefit in September, offering $500 a week for 2 weeks to those unable to work because they're sick. But advocates say that benefit pays less than full-time minimum wage jobs, and low-wage workers still experience financial loss if they access this support rather than working while ill.
What you're doing is you're thinking about, will I have enough money to pay the rent, to be able to pay my bills? And that is what happens to workers if they don't have seamless access to paid sick days.
There has been an almost unanimous call from public health experts, big city mayors, and advocacy groups to implement paid sick days since last spring, but the Ford government hasn't indicated it has ever seriously considered it.
The Premier has been ignoring and been silent on this issue, which I think is really horrendous. He seems to be under this complete false assumption that if you need a paid sick day, all you have to do is ask your employer that, hey, I'm sick and I need a paid sick day. That's not the way it works in real life.
We did hear back from the province today, and it sounds like they're still not considering implementing paid sick days. In a statement, Ontario's Ministry of Labour tells us the government has been clear that the federal government would provide funding for paid sick days and the provinces would implement job leave protection. They say one of the first things they tabled during the pandemic was to give workers unlimited job protection to ensure those who stay home to self-isolate will not be fired. It will remain in place for as long as necessary.